a media briefing ahead of the anticipated National High-Level Dialogue on Health Financing, Health Cabinet Secretary Susan Nakhumicha emphasized that accountability is a top priority in health resource management. The CS warned that public officials will be held responsible for resources allocated to them. The dialogue that will focus on health financing is scheduled to kick off on the 26th to the 28th in Nairobi. Barbara Gamba with that report.
Big problem. And one member said that how is it that over 60% of payments from NHIF goes to private facilities? Chair and honorable members, it will shock you that of the payments we made this month, after having delays from Exchequer for a long time, the top facility to be paid is one that we have suspended.
At a time when issues around health financing, its affordability and accountability by public officials handling health services are a matter of grave concern in the country, the Health Cabinet Secretary Susan Nakhumicha shed light on the objectives of an upcoming national high-level dialogue on health financing. Nakhumicha further revealed that the move will seek to mobilize stakeholders to assess health financing strategies, review progress, identify challenges, and establish reform priorities. The dialogue will focus on the following key areas: more money for health, more health for the money, equity in finance and financial protection, and country leadership and governance. Recent allegations of fraudulent practices have raised concerns about the integrity and transparency of the National Health Insurance Fund, NHIF. Earlier today, an article on one of the dailies published a story claiming the human rights activist who blew the whistle on hospitals involved in medical fraud is now fearing for his life after receiving death threats. Under the health sector, imperatives to achieve universal health coverage include the need to mobilize adequate resources, increase investments in primary health care, and reform key institutions such as National Health Insurance Fund to align them to the UHC agenda. In Kenya, only 1 in 5 of the population has some form of financial protection from healthcare costs.